Both of us were involved in the USA clinical trials for Aquamid. And you know, that same prejudice that Rhoda was talking about, I had filled in before I agreed to go into the trial with the idea, permanence, do I want permanence? Are all the stories I'm hearing true? And I can say that the trial itself and the patients that I took care of really dispelled a lot of those beliefs or prejudices I had before, because I was able to see how well this has done, and I'd just like to present to you some of the reasons why we think that there is a place in the market for this, there's a place in your practice and for your patients. The only relevance here is I have done work for Contura as far as a consulting and with the trial. So in the U.S., we don't have many that are really long-lasting. Radius is a year, Sculpture is about a year, and silicone, which is off-label, and Artifil, which is a particulate filler. So our patients are asking for something that's longer-lasting. They like less maintenance, few times they have to go in for needle sticks, less overall costs. They don't want to see the physician all the time. Well, many of the physicians do want something more temporary that's easy to inject with less worries and don't mind the visits, but their expectations, they want a procedure that's easy with no pain, reliable, minimal or no downtime, and they do want longevity. So we want a product that's available, it's malleable, early results, very few AEs, and longevity is important. There was market research that was done by the Contura Corporation with two large studies in the U.S., 167 patients, where they had recently had neurotoxins and fillers. They were from 121 derm practices and plastic practices, and they were asked questions, what are their desires as far as fillers? Do they want duration? What does the consumer and the MD reviewing Aquamid marketing material think of it? And are they aware of what they're getting and their purchasing power? Well, I'm going to go quickly through this, but it really just shows that if patients are not satisfied with current brands and seeking new options, many of them are asking their doctor, what else is out there? What's available? What's longer lasting? And these are just the percentages, and you can see that over 60% of the patients, when they come in for a repeat visit, are asking those questions, that they don't just say, do what you did last time. They're saying, what else can you give me? I want something longer. I want less treatments. What will last longer? They are the top 4 reasons why they return less often when asking doctors is first financial, longer results. It's inconvenient to keep coming back for appointments, and not all of them are satisfied with current enhancers, or they've had some side effects. Both in dermatologists and plastic surgeons have noted that some of them have said that they want something longer and they're not returning because they can't get the longer lasting results. So patients want longer results actually than physicians want, but on the same token, there are consumers, and they're the ones we have to look toward and feel. Aquamid can substitute for other fillers in many indications. Our experience is the nasolabial fold. You're going to hear from Chris Inglefield, his experience in many, many other areas, and worldwide it's in many areas. But I can tell you that out of the study we've done, our patients were very happy with what we had, and in follow-up, they're still happy and satisfied. So we're looking for something that's going to volumize, that can do some sculpting, we can do deeper injections, there's very little pain, and long-lasting. And this is where it does fit the bill as we have traveled from wrinkles to lines to now sculpting faces and giving results of longer term that we can. What we have in our portfolio under evaluation now in the United States is Juvederm Voluma, which is an HA with probably a 1-year length of stay, maybe a little longer, and Aquamid, which as we know has a much longer period. We have to ask ourselves, do we have efficacy? Do we have safety? Do we have durability? Is it effective? Is it long-term? And is it biocompatible? And I think that you're going to see both on these studies and what Rhoda's presented to you, this pretty well does fit that bill. But you've got to change over your thought process, and that this isn't a quick, easy, wipe a little makeup off, use an alcohol sponge, and shoot a needle in. Think of it as an injectable implant. and you have to go to a little more of a fastidious nature. You need to be sure that the patient has been sterilized and truly is clean on their face, and you're not introducing a bacteria into the implant. Now, I'm sure that we're doing this with some of the HAs when we inject them, but because they're not longer lasting, we can get away with it. You're not going to get away with it with a long-term implant, but the results are well worth it. Well, this is essentially our study design. It was a double-masked, randomized, 2-to-1, multi-centered trial with, first you can see a screening period, 210 subjects. There was a treatment for optimal maximization on 3 sessions, though many of them did not receive all 3 treatments, and it was against Restylane. 210 got Aquamid, 105 got Restylane, and they were followed up at 3 months, 6 months for maximal efficacy, but then an extension study to 1 year and then beyond to 24 months. The primary objective was a non-inferiority study for 12 months and safety and efficacy of Aquamid through 24 months. Nasolabial folds, which is what the FDA wanted, were injected. We had 13 sites scattered around the country. I had to change a little of the geography around when we made the map to where we were, but as you can see, it covered a vast area. The 12-month clinical study, double-blind randomized, 2-to-1 Aquamid to Restylane. Again, this is percentage of subjects improved by subject evaluation at a period of optimal treatment. Again, 96 to 100% got optimal treatment. You can see at 6 months, close to 90% were maintained at optimal treatment, and this is both for Restylane and Aquamid, which is what we would expect. But at a year, we're already seeing some decline in the Restylane package, while Aquamid has remained its improvement throughout the 12 months. Now, we look beyond at 24 months. We don't have Restylane figures for 24 months, but we know what happens. But here, the Aquamid still maintained its GAIS over 90% of subjects with similar improvement up to 24 months. So this is 2 years statistics. Other studies have it beyond. Some of the patients we've looked at baseline, 12 months, 24 months, no change. But you know what? I think one of the remarkable things is that the feel of Aquamid, and you think of a permanent filler, our prejudice is to feel and think of something stiff, something hard that's going to soften up. Aquamid is soft from the get-go, and it's remarkable how bio-integrated it is, even the very beginning. So it's soft, it's pliable, but it has that maintenance, and I think it's because of what you heard, the integration of the product into the tissue, where it really becomes a scaffold for normal tissue to grow into, so it has that biocompatible, very nice feeling. The first 2 weeks of injection before it's integrated is a period of time we've got to be very careful that there are no other non-sterile procedures done around the area, because it's at that time there's a risk of the possibility of infection, and that's what we should look for. So in the U.S. study, there's no long-term complications. There were some. There was one early infection. It was caught because there was some redness and there was some inflammation. They were immediately put on antibiotics and resolved. And one late infection. When we get an infection, I think it truly has to do with the fact that bacteria was introduced. And that's why I really must emphasize that you have to be a bit more fastidious with a long-term implant rather than just injecting a filler, as far as sterility, cleanliness, and your care of it in that first period of time. But it's well worth it to the patient to understand that because of its long-lasting attributes. So who's right for these patients? Well, patients who want a long-term, durable, natural, safe, aesthetic solution, who will tell you, don't you have anything that lasted longer in your practice that's safe? When you see people on this, ensure realistic expectations, evaluate the readiness for a lasting solution, that this is what they want, and that you've gone through the disclosure, the risks, the benefits, and the treatment process. And also, these patients have to know that they've got a long-term filler in them, so that if they go for other treatments and other things, they can relate to the doctor who's going to be doing that there is a long-term durable filler. And in this way, they'll avoid some of the problems that can occur if non-sterility occurs. We find both in structural and volumizing implants that there have been reported problems of nodules, granulomas, biofilms, but I think most of them are infection-related and caught early. That's not a problem. Again, this was not seen in our studies. This is just an example of a different implant that formed fibrotic granulomas that were not picked up. This was not Aquamid. So we have to look for these things for any long-term implant and what can happen. But in Aquamid, it fulfills most needs identified, longer duration, deeper injections, volume filling, sculpting. There's 10 years of experience, and there is a need for physicians to complete their portfolio.